Today, we are going to be looking at central line insertion. You would begin by opening up the kit under a sterile fashion and donning the gown and gloves in a like fashion. For a blind insertion technique, which is being demonstrated here, you would begin with a physical assessment of the patient and identification of the landmarks. With the patient's head turned slightly in the opposite direction, you would assess for the triangle that exists on the patient's neck, midsection between the sternal notch and the mastoid process. It's also important to place the patient in the Trendelenburg position to prevent entrainment of air into the venous system during cannulation. You would then prep and drape the patient using a sterile technique. You should again palpate for the carotid pulse and place the hand gently over the carotid pulse and pull gently in the opposite direction from the underlying artery of the intended needle stick. You would insert the finder needle connected to a 5 or 10 cc syringe at a 45-degree angle toward the ipsilateral nipple line. While inserting the needle, continue to aspirate on the syringe until a steady, free flow of blood is observed in the syringe. Slide or gently twist the catheter flush with the skin line into the neck and remove the needle and syringe. After the needle and the syringe are removed, place the thumb over the cannula hub to prevent bleeding. Retrieve the guide wire and insert the guide wire through the cannula without forcing until resistance is felt. While inserting the guide wire, continue to glance at the monitor to ensure that the guide wire is not causing any ectopy on the EKG. If ectopy is noted, pull the guide wire out slowly until it is resolved. At this point, the cannula can be removed and a notch made in the neck, or it can remain in place as demonstrated here while a notch is made. In either case, the notch should be made on the neck on the opposite side of the neck from the palpation of the carotid pulse. Remove the cannula if it is still in the neck. Insert the dilator over the guide wire. Be sure the dilator will move through the neck structures flush with the skin line. Remove the dilator, again holding onto the guide wire from above or below as allowed. Take the central line catheter and remove the cap from the brown port. Clamp the other ports. Thread the catheter over the guide wire, holding onto the wire at the skin line, and slide the catheter into place, being sure to grasp the guide wire from above through the brown port as soon as it is available. Insert the catheter until it is flush with the skin line. Gently remove the guide wire, ensuring that the catheter tip is in place upon removal. Replace the port on the brown port site and flush each of the ports to ensure that blood is free-flowing from each catheter. Suture the catheter to the neckline for stability.